We are live. Leah, please.
Okay. Welcome to the Aliyah support group. My name is Leah Chaimov. I am founder of Aliyah support group, and we are here to assist all of you in making Aliyah process more smoother and more comfortable. We're also here with Aliyah support group, Russian Aliyah, and Sophia. Please introduce yourself.
Yes, so welcome everybody. My name is Sophia Gordon. I'm organizing the Russian American Aliyah group, and we are helping Russian Jews who currently are living in America make a smooth Aliyah process. And we also have here Rivka from RAGE, who is supporting us, and WZO, Ilana from WZO. So there are a lot of people who want to help us make a small transition, and we are welcoming our guests here, Rivka Ginsberg and Dr. Rosenzbaum.
Yes, Dr. Efraim Rosenzbaum is a pediatrician and medical manager at Leumit Ramat Bet Shemesh branch. And Rivka Ginsberg, we're very excited to introduce our community relations coordinator in Ramat Bet Shemesh in the Leumit branch. Welcome to our Aliyah's Zoom session.
Thank you.
The floor is all yours.
Okay, so first of all, welcome everyone. This is an exciting opportunity for us because usually we speak on the phone one by one, but we have this opportunity to get you all together to hear about the amazing community and services that we have. I made this little video clip that part of our staff introduces themselves. I'd like you to take into consideration, it's only a small part of our staff, but they're amazing and they want to welcome you. Leah, could you put the video on?
Sure. Sophia? Okay. Sophia, are you able to do it, or? Okay, maybe we can continue on.
Okay, if not, we could do this later.
Yeah.
So today we're going to be speaking about the healthcare system in Israel.
I can do it right now if you want to.
Great. We don't see it that well, so maybe you can make the screen larger and we don't hear it.
Okay, I'm sorry.
The sound is not so good.
Yeah, we cannot hear. You should also share the sound settings of your computer.
Sophia, you need to stop sharing, and when you restart sharing your screen, it will be button sound.
Okay, so maybe we'll do it at a later point.
Okay.
Okay. Sorry for that.
So as I was saying, we're going to be talking about the healthcare system in Israel. Dr. Rosenzbaum is going to give you a view of the different services and zchuyot, how do you say zchuyot, of the healthcare system in Israel. Dr. Rosenzbaum, bevakasha.
My name is Efraim Rosenzbaum. I'm a pediatrician, and I grew up in Boston, Wayland, Massachusetts. And then I went to college in California at Stanford. And then I went to medical school in Philadelphia at Penn. And then made my rounds back to Boston. And I trained at Harvard for pediatrics. and I was in practice there a couple years before making Aliyah. I took 2 years off in between university and medical school to come to Israel, where I learned in yeshiva, and met my wife here. And then so the dream was always to come back, and it took us, we were on the 3-year plan and the 4-year plan. Things get complicated, as you all know. My family lives in Boston. And so, but after 5 years, finally, my oldest was 6 years old, and we felt it was time to move. It was very, very hard to move, mainly for lots of reasons, but mainly from the family. Being away from your family is always very difficult. So we're here now 20 years. This will be 21 years in June. And, best move I ever made for me, for my children. Can talk about it all day. We have guests all the time, not so much during COVID, but yeshiva students, seminary students, and it's a common question. Why did you make Aliyah? So it's the 3,000-year dream we're able to fulfill, and here we are. That we have the skills to be able to do that after all these generations. So anyway, it's a big skills to be here. And I think when I came, I was a little bit worried about the medical care system and relative to the American system. And fortunately, I've been very, very happy with the system here, how patients get care, how we're able to give care, the flexibility, the options. I'm going to take you a little bit through the healthcare system in general, and then a little bit more specifically, so when you come to Israel, how do you access the medical care system? And we'll save the end for any kind of questions. Just write them down, and we'll happy to answer anything you have. So overall, from my personal perspective, the Israeli system is a much better system than the American system. For many reasons, there are some issues that it's less good, and I'll talk about that. But overall, it's a better system because everyone can get healthcare here. They have easy access to healthcare. Their primary care doctors, their specialists, their medications. It's really super simple. And we saw, and as we could see with COVID, once we had a mission to do, which was to get people their shots, besides getting them, that was more the government, but giving it out, as we can see in America, is very, very difficult. My 93-year-old mother-in-law still hasn't gotten her shot in Florida. And my parents are 80 in Boston and just getting theirs now. So, it's been, I think, more difficult than America. Here, everything is much more centralized, for better, in general, for better, a little bit for worse, which we'll talk about. So basically, the overall healthcare system here, there's 4 HMOs that you have to choose, and you have to be part of one of them. There is private medicine here. We can talk about that at another point. And it is a nice mix of public and private system, but overall, the public system tends to work very, very well. So there's not a whole big need for the private system, at least when it comes to primary care. Sometimes in specialists, sometimes in surgeries, the specialized system, the specialist system is important. And Rivka will talk a little bit more about that and how you access that at discounted rates. But overall, the public system works very, very well here. And okay, I'll discuss about medications and to bring one landing. Yep. Okay. Overall, the system, there's 4 HMOs here. We've got by sides, you've got Klalit, and then you have Maccabi, and then you have Miuchedet, and then you have Leumit. And depending on where you are in the country, the certain HMO is strong. Each of those HMOs is stronger in various cities, various areas. Depending on where you live, you have to do a lot of homework. Ask your neighbors wherever you're moving to, who they're associated with, what they like about it, what they don't like about it. Just like you would investigate a new car, a stock, or your house, your neighborhood, you should do the same thing with the Copad. Don't just rely on us. Don't just rely on one neighbor. You should hear the downside, the good sides and the upsides of each of the different Copot. So there's 4 different Copot. Again, size is sometimes good, but sometimes it's a drawback. In Leumit, we are the smallest Kupa, but there's a lot of benefits to be what's small. Small means we have 750,000 members out of 10 million Israelis. And the benefit of that is, when you walk into one of our branches, everyone knows your name. Everyone says hi, you know their names. And it's much more of a family focused, like, personalized system. Each of the different HMOs has to offer the same services. There's something called the basket of services in Israel, and every HMO is obligated to give all of those services, whether it's in primary care, whether it's in medications, whether it's in radiology, whether it's in hospital services, whatever it is, they all have to give the same services. And the difference ends up being much more in the character of the Kupa. I would say that the benefit of Leumit, for example, is we tend to take a little bit more, because it's a little bit more personalized. Doctors like to spend more time with patients, and they give us a little more time to spend with patients. Some people like, we have more branches, small branches. Some people like one centralized branch. Some of the bigger HMOs, they have one big branch. They have all the services there. Some people prefer something like that. Everyone likes something different. You have to really find out. You should make a long checklist of things that are of importance to you, and then find out what's happening in your area about that. The bigger HMOs tend to have more specialists that come to those big branches or to that city. Sometimes if you're in a smaller one, you'll have to go outside the city. But again, there are benefits of bigger versus smaller. The other big benefit of Israel is the medicines are cheap. There's very few people in Israel who can't afford their medications. Doesn't matter whether it's for simple medications or for cancer therapy or for diabetes. Many things like diabetics, I think, don't pay anything, if not mistaken. I don't, probably Rivka can help us with that, but many chronic diseases are fully covered.
There's a limit to how much you can pay for medications. It's limited. If you reach the limit, you don't pay anymore.
Right, and the limits relatively here in Israel are super low compared to what you're used to in America. Most medications here have a copay of 18 shekels. What's that? $4, $5. I don't know. When I was just in America recently, I think my copay, or my mother-in-law's copay was $50 or $75, something, for her medicine. So almost all medicines here are $5. So in general, people can afford their medications here and they can get their medications. Whereas, at least my experience in America was that because it was so expensive, many people, 30%, I think the number was, people are not getting the medications that they really need. And it doesn't matter if it's high blood pressure or cholesterol or ADHD medications. Medications are expensive in America. So that is a challenge. It's not much of a challenge here, fortunately. And again, there's very easy access to your primary care physicians. Most specialists come to most of the cities. Pharmacy is usually right in the branches. Very easy access to them. Now you even can order your medications and they'll come to your house. That's a new service I know Leumit is offering. I don't know about the other Kupot. Your lab testing, your radiology is oftentimes all just right in your branch, or at least in your city where you are. Your local city in Beit Shemesh is broken up to, we have, for example, I think 11 branches here in Beit Shemesh. All in Ramat Beit Shemesh Aleph we have 2, in Ramat Beit Shemesh Bet we have 2. So people don't have to, a lot of people here don't have cars, so you can walk to the, you don't have to walk to your branch. And so it's very available. That's the big positive of being in Israel. And the quality, I think, and efficacy was probably best seen like what happened with COVID, both in regards to testing, both in regards to getting everyone shots. I mean, it was incredible. Within the first few days, my people that I knew who were over 60, they're getting SMSs. They're getting SMSs to call and invite them to come in. They can, on their app, on their phone, they can call and make an appointment for their immunizations right away. So, I would say in our HMO, certainly within 3 weeks, 4 weeks, 80% of the people over 50, 60 were all immunized. And it was super easy, and that's the big positive. Some of the downsides of the systems. So because it's a socialized system, it's sort of like, I guess, any insurance company in America, the insurance company decides what things they're going to pay for and what things they're not going to pay for. So there are sometimes medications, or there are sometimes procedures, there are sometimes diseases that are not in the basket of services. And when that happens, usually your supplemental insurance, which Rivka will talk to you about, will cover a significant portion of those medications, of those procedures, of those diseases. And once in a while, there are things that just aren't offered in Israel. Let's say like liver transplant, super hard to get here. Both my patients who had those, one had to go to Belgium, one had to go to America to get that. That's fully covered by the Copad, you should know. Things that the Copad does not have, or then they will send you on their own expense to those places. Now, if there's a procedure here, let's say someone needs, again, I'm a pediatrician, so someone needs a certain type of heart surgery that is done here, but someone will bring in and say, look, the data is that it's better to do it in America. Those things the Copad won't cover. And so therefore, you would have to cover that on your own. So there are certain procedures, there are certain things that I personally send to America. They're rare, but I would say that is the one downside of the system here, is they don't have the same mass of amount of people about who they're doing procedures on. So there's only 10 million people here versus 300 million in America. So you can imagine that the referral centers in America get much, much more experience. So there are certain unusual procedures that we do send to the States for, that aren't, or we recommend people to go to the States for. So getting supplementary insurance to cover those, depending on your risk tolerance, you have to decide that before you come. You can decide when you come here. Some of the supplementary programs will cover it, and some people get any additional to the supplementary insurance of the HMO. There's supplementary insurances that are private, and those will cover everything. Should you have any type of procedure, cancer therapy, something that isn't covered in Israel, or that's covered but it's not as good, and you want to go somewhere else, then you can get those kind of coverages. Again, the rates for most things in Israel, probably will be shocking to you. The pricing is just incredibly small. So, if you need to get supplementary insurance, Rivka is going to talk about that. It's, I don't know, $10 a month, $20 a month for a kid, or even less than that. And then even the private insurances are super, super cheap relative to what you would expect in America. So again, that's the overall system, pluses and minuses. Let's talk about things on we talked about the basket of services, what's in, what's out, what happens when they're in and what they're out. And every year those things change, just so you know. In general, very few things go away. Every year they're adding to the basket of services, adding medications, adding procedures. The economy of the country tends to be good, and the healthcare system tends to have a very good lobby. So it tends to be that we're getting more and more services as time goes on, and that's the basket of services. Now, on a practical level, picking your Copad, again, we discussed a little bit about that, or I mentioned a number of things. Different Copot are stronger in different areas. In Beit Shemesh, right? Really, Leumit, we have a majority of people. I think if you're interested in having English-speaking doctors, like, almost all of our doctors speak English. Most of them are either from America or from Australia, South Africa. So, it's important you feel comfortable. Some of the other Copot may have more Israelis. Russian speaking, I don't know if that's important to you. We can find that out, but I don't know. We have some Russian speaking doctors, but I don't know how many. I know one of our OBGYNs is a Russian doctor. If that's important, again, important to do your homework and figure out what's important to you in relationship to your medical care, and the type of doctors that you need, the specialists that you need, what's available in the area that you're moving to, how much you're going to have to schlep or not schlep, whether it's schlepping within the city or outside of the city. If you have some chronic disease, it's important. I had a patient who had a very rare genetic disease, and I told them that you really shouldn't be in our HMO, because this HMO has a special center just for that disease from all the Copot. And that's really we should go, and you shouldn't be joining us. So that happens sometimes. It's important that people know what even though all the HMOs are offering that, and we offered that service and that medication, it was much more complicated. That you had to go to Tel Aviv, and it was much more difficult to get than for this one big center that they had in Jerusalem, which was closer and on the bus line from Beit Shemesh. So if you have like chronic medications, chronic diseases, important that all that stuff you discuss with Rivka and you discuss with your neighbors to again find out, do they have the doctors here? Do they have the services that you need? And these days, again, sometimes it's helpful today I got a text from someone making Aliyah, and they wanted to meet with me before they came, which is great. You know, I'm all for that. And important that you know how available your doctor is. What are their hours, and how are they available by email? Most of the kupot know, I think, you can email with your doctor. We have texting, meaning WhatsApp, texting. You can email or you can text via the app to your doctor. All the HMOs have apps. I don't know if they all have the direct connection to your doctor, communication with your doctor. Probably most of them do. Our doctors are pretty good about giving out their cell phone for off hours for emergencies. So that's another important thing to ask. What do I do when I have an emergency? Most of the HMOs have like a 24-hour call-in. You can speak to a nurse, you can speak to a doctor, but not necessarily your doctor. So one of the nice things about at least Leumit and Beit Shemesh, everyone's different, is that we're pretty available for our patients 24 hours a day. Thank God our patients are wonderful. They don't abuse it. And, you know, it was something that was important to me in America to be available 24 hours. And we had a group that was available. Here, the individual doctors, even though we work as groups, in general, take their own call for their patients. And it tends to work very, very well. We appreciate it. The patients appreciate it. So good to know about that. Next, so that's about your doctor. You should get to know your doctor. You should meet your doctor whenever you come. 2 is your card. You're going to get a card from your HMO. Very important the first few days that you're here to get your card. You can't do anything without a card. Your doctor swipes your card. Your pharmacy swipes a card. You go to the nurse, she swipes your card. It's a way to get into your system. Everything is centralized here. It's a great system. You go to the hospital, you swipe your card. I get the record from the radiology. I get the record from the specialist that you go to. It goes right to my integrated teak. It's a phenomenal system. And you can see everything that's happening to a patient. And you can see it too on your app. Everything in your medical record, it's totally transparent. You can see what we're writing. You can see your medications. You can see your labs. It's a phenomenal thing. You can get it online or you can get it on your app. So that's a really cool thing, but you have to get that card. Don't forget to get that when you come. Get that usually from your local branch, wherever you're moving to. How do you make an appointment? So basically 3 ways to make an appointment in Israel for primary care and for other specialists. 1 is you can make it on the app. 2, you can make it online, or 3, you can call. So you can call, there's a call-in center, national call-in center, and they make the appointments, or you can call the local branch and make an appointment that way. Good to have an initial meeting once you come and sit with your doctor, go over your chronic medical issues, medications, bring a hard copy of your medical file. Okay, so this is, Israel's a little bit behind in this. So a little bit annoying. We can't get anything from a disc. We can't get anything from a disc on key. So you need to print everything out like the old days, okay, and bring your stack of stuff. You know, ideally, you know, have like your doctor write a 1-page summary with a list of your medications, allergies, current issues. That's the best thing, but you can bring everything. We can scan everything into your chart here, all your paperwork, but at least at this point, I don't think any of the HMOs can use a disc or a disc on key to get your medical files into our files. So they all have to be scanned in. So that's an important thing to do. Sit with your doctor. And if you're on chronic medications, bring 3 months of those medications with you, just in case it turns out for whatever reason you thought the medications were here and they're not. Just make sure you have those 3 months of medications with you. Again, I would say any chronic medication you have, make sure that they have it here when you come, and call ahead to the pharmacist, call Rivka, she'll find out for you. Do we have that medication here in Israel? It takes our time, but that's what we're here for. We're here to help you, and you shouldn't be coming here with any questions of your medications that you can get them here. That would be, it's not great when someone comes and I thought that, I was going to get this here. I would say we have 10 medications for ADHD. You have about 20, 25. I'm an ADHD specialist as well. So they've got about 10, 20, 25 in America. So we don't have guanfacine. We don't have Daytrana. There's a lot of things we don't have. So, we have things to replace those. There's not too many things we don't have to replace, but they're not the same thing. And if those things are critical, then you have to find out about that. Couple last things I'll go over. Don't go to the emergency room. When you come, don't go to the emergency room without a referral. Here in Israel, everything, you have to get a referral from the doctor or from the call-in center. Or you can always go to the urgent care centers, either in the Coppa or something called Terem. They're all around the country. If you go to all those different things, then you can, they will give you referrals to the hospital. Don't go yourself to the hospital. You'll end up paying 700 shekels or more and out of pocket. So very, very important thing to always just keep in mind. Most prescriptions these days, mostly are digital now. You can go right to the pharmacy. You don't need anything in hand. Everything gets put in the computer every 3 months. You can request it online via the app. You never have to get anything. You don't have to get any papers. You just go right to the pharmacy and they'll fulfill that for you. And again, we're here I saw that there's lots and lots of questions here. And but I guess we'll have Rivka talk, and then maybe we'll go through the questions one by one.
So before Rivka start, maybe we can have the video play, and then you can continue on with the presentation.
Yes.
Okay, sure.
I ran 2 clinics in the last semester. To all of you, waiting for you. Hi, my name is Dr. Shoshana Gross, and I'm a pediatrician with Copet Leumit in Beit Shemesh. I made Aliyah 11 years ago from Atlanta, Georgia. I'm originally from Queens, New York, and I went on to study my undergraduate studies at the University of Michigan in Ann Arbor, and then medical school at Sackler School of Medicine in Tel Aviv, and then I did my pediatric residency at North Shore LIJ. Upon making Aliyah 11 years ago, I started working with Copet Leumit pretty much right away. And I love it. I love working for Leumit. I love working in Beit Shemesh. I love being a community doctor and having a short 4 or 5 minute commute by foot to work every day. I love being able to see my patients in the supermarket and on the streets. I view my patients as my friends and my family. Probably that's why they all have my telephone number. I think it's amazing to be able to live here, to be able to work here, to be able to care for the young generation of Israel. I wish everyone about Tzlacha on their Aliyah, and you should only come in good health. And just be rest assured that the health care in Israel is amazing. It's superb. And the doctors here all care for you, and they really just want the best health for you. And you're in good hands.
Hi, welcome. I'm Jeremy Barron. Made Aliyah from Baltimore 4 years ago. I working in Baltimore at Johns Hopkins as a geriatrician. I just started working here at Beit Shemesh. A few minute walk from where I live. A couple months ago, I'm very happy to be here. It's a great environment. And it's a great community, a large number of Anglo people and patients here. Warm, friendly people and nice families. My kids are happy in their schools. It's a pleasure to come to work every day. It's a pleasure to go home from work every day. Hope that some of you will be able to join us here.
I'm Esther Ferdig. I'm the nurse here at Leumit. I'm looking forward to welcoming you to Leumit Health Services.
Hey, Rachel, introduce yourself.
Hi, I'm Rivka, the nurse here at Saline. Welcome. Hi, my name is Dr. Malka Blas. I'm an internal medicine doctor in Copet Leumit here in Ramat Beit Shemesh, which is a wonderful community for Olim. I've been living here for close to 15 years, and Baruch Hashem, we're very, very happy here. I want to welcome you to Leumit. We'd be happy to meet you and help you through this process of Aliyah, which is such an exciting thing. I'm originally from New York City and lived for many years in Baltimore and trained there. On my way to Ramat Beit Shemesh. Good luck to you.
Hi, I'm Chana Berkovitz. I'm a supervising pharmacist for Leumit in Beit Shemesh. Before you come in Aliyah, I wanted to offer you a couple of tips. The first is, if you have a chronic condition where you take chronic medication, it's a good idea to make sure your medications and supplies are available here. Another piece of advice is to bring at least 3 months worth of medication with you, so that it gives you time to get things sorted out over here. We look forward to welcoming you in Leumit.
Thank you. So you got a glimpse of some of our staff in Ramat Beit Shemesh. Let me introduce myself. My name is Rivka Ginsberg. I was born and raised in Jerusalem. I'm Israeli, Tzabar. I've been living in Ramat Beit Shemesh for the last 20 years. And I love it here. Amazing community. And I work for Leumit the last 10 years, and I love it too. I love the staff here. I love helping out new Olim. This is what I do in the Kupa. I deal with newcomers. Once Olim arrive here, I meet with them. I take care of all their, set them up in the system, make appointments for whatever they need, introduce them to the doctors they need. And just, I walk them through the beginning, which is, overwhelming sometimes. So this is what I do, and I love doing it. It's the best part of my job. Now, Dr. Rosenzbaum gave you the information about the healthcare system, and I want to give you a little bit more information about the supplemental insurance. I saw there were some questions on the chat. I'm going to answer some of them. So what does the supplemental insurance give you that the health basket does not? So first of all, Leumit offers 2 levels of supplemental insurance. There's gold, which is the higher level, and there's silver. Obviously gold covers more, it costs more, but it's really it doesn't cost much. For instance, a couple in their 30s with 5 kids would be paying less than 200 shekels, which is about $50 a month for the whole family. With age, it goes up a bit, but still stays very cheap. It's totally worthwhile. Now, what does, and as Olim, by the way, Leumit gives you special benefits. First of all, when you arrive, you could join the gold insurance for free for the first 3 months, which is amazing. And you have no waiting periods to get all the benefits of the supplemental insurance. So just make sure when you come to mention, if it's not me meeting with you, if you come somewhere else in Israel, to mention that you deserve the Olim benefits, and you could contact me if necessary to take care of that. So what does the supplemental insurance give you? I'll just list some of the benefits because there's many benefits that I cannot list them all, but I'll give you the main points. So we were talking about medications. So like Dr. Rosenzbaum mentioned, there's the health basket covers many medications. Most of the medical, needs are covered, but then you might want to use a different medication that's not covered in the health basket, or something that the doctor recommended. Then you get a significant discount with the gold insurance. It could come out to be 50% less, 80% less. It's really significant. Then the next benefit I would say is the option of going to private specialists. So you have the option for each member of the family to go 3 times a year to private specialists. The great thing about Leumit is that they don't limit you to a list of specialists you could go to privately. Almost any specialist in Israel is covered through the supplemental insurance. So depends who the specialist is. There's two ways to, depending on who the specialist is, it's either you get reimbursed 80% up to a limit of 680 shekels per session, or you pay co-payment to these specialists of 200 shekels just for, they usually cost over 1,000 shekels to go to. So it's an amazing benefit. And people use it all the time. You want to get a second opinion. You've been to a doctor in the Kupa, they say you should get a procedure, you want to get a second opinion. It's an amazing option. So another benefit that the supplemental insurance gives you is the option of going for private surgeries, private procedures. The way we work in the Kupa is in general, if a procedure is needed, the doctor in the Kupa would refer you to the hospital. The Kupa would, in almost all surgeries, not talking about cosmetic or different stuff, but in general, it would be covered. You'd pay 30 shekels co-payment. It's amazing. It's all covered. The hospitalization, the surgery, the aftercare, everything is covered. Now, the option with the supplemental insurance is to choose your surgeon, which is very important. You have a choice within the Kupa without the supplemental insurance, but here you have a wider choice. With a co-payment, the co-payment would start between 500 shekels to 4,000 shekels, depending what the surgery is and who the surgeon is. So the next benefit, pregnancy and birth basket, which is amazing. It's, first of all, I had 5 kids here in Israel. The system works amazing. Okay, first of all, follow up in the Kupa. This has nothing to do with the supplemental insurance. We have great OBGYNs. You have a nurse following up with you on the during pregnancy till birth, and then the birth is done through the hospitals separately from the Kupa. Now, the supplemental insurance gives you extra options. It gives you more options for tests that are not in the health basket. It gives you, during birth, you could have a private doula come with you. You can have a nutritionist session after birth, lactation consultant, which, by the way, Dr. Gross and Dr. Rosner, who were not on this, who was not on this video, Dr. Gross was. They are lactation consultants, and it's free. You could go to them through the Kupa. But if you want to go privately, you could also get reimbursed for that. The way it works is the birth and pregnancy basket gives you benefits of up to 2,000 shekels. You decide how to use it, if you want to use it for a doula or for other benefits. And the amazing thing that we offer too is after birth hotel. So besides the 2,000 shekels through the health basket, you can get another 3 nights, 350 shekels per night for after birth hotel. And Leumit is great because they allow you to go to any hotel in Israel, and not only for what's called the Beit Achlama. So you could go with your husband for a weekend and Leumit is going to pay for it. It's amazing. So you could go up to 6 nights, depending what number birth it is, and you'll get reimbursed a nice amount out of it. Now, another benefit that people use all the time through the supplemental insurance, this is for younger families. So we didn't talk at all about the child development services. Leumit and all Kupot actually offer a wide coverage for child development services starting at birth till the age of 9. Now, the amount of therapies, if we're talking about speech therapy, occupational therapy, physiotherapy, are depending on the age. The younger the kid is, the more therapy he's entitled for. Obviously, you have to go through the process of evaluation and then approval, and you start getting therapy through the Kupa. We have amazing therapists working for us. If it's for speech or occupational therapy, we have therapists who speak English too, which is more convenient for English speakers. So in a case where a child has used up all their therapy sessions through the health basket, and they do need more therapy sessions, they would be entitled for extra therapy for 20 shekels a session through the supplemental insurance. Just to give you an idea of how much it costs, it's around 250 shekels if you go privately, and here you get it through the supplemental insurance for 20 shekels a session, which is amazing. Now, the basket of therapies for children up to the age of 18 includes also the child development services, but also emotional therapy. So we allow children up to the age of 18 to receive 50 sessions a year of therapy. You could use it in so many ways. It's amazing. You could use it for swimming therapy, for art therapy, for music therapy, especially for kids who make Aliyah. This is so important because, you know, the first year or two of Aliyah usually are not easy emotionally. And this is a way for them to let out their emotions and to work through this process of Aliyah. So there's two ways to get these therapies, the emotional therapy, either with places that work with us, and then the copayment is 45 shekels per session, or getting reimbursed for part of this private therapy. Okay, so those are the main benefits, I would say, of the supplemental insurance. Someone asked about supplements. Yes, you get discounts for supplements with the Leumit Gold too. We sell it in our pharmacies. Some supplements might be less expensive in the States. It's worth checking out and maybe bringing a supply with you. You could also order on iHerb. It's easy. They deliver here, but many of the supplements are actually covered through the health basket, like vitamin D or, you know, iron or whatever it is. But some supplements you could get discounted on the gold insurance. Dental care. So dental care is covered till the age of 18. With certain co-payments for treatments, low co-payment, and there's discounts for adults. To be honest, our healthcare system is amazing. Like our primary care doctors are amazing, like really, really good healthcare. When it comes to dental and to psychiatric care, the care is okay through the Copot, but it's not tops like all the rest of the fields. So I've been treating myself through the dental care of Leumit, and I've been happy, but I haven't needed anything major. So did my kids. We had fillings. It was great. It was almost free. So when it comes to dental care, it's worth, you know, doing your homework, checking out which clinics. We have 4 clinics working that work with us in Beit Shemesh. And, you know, there's different doctors. You could speak to me. I'll help you out through the dental care too. There's also discounts on glasses for kids. It's covered once a year. You get a pair of glasses for 20 shekels. Adults get a significant discount on glasses with places that work with us. In general, most people, I would say more than 90% of our members have the supplemental insurance. You could always cancel it. You could always downgrade, but don't. It's important to have. There's another insurance that we offer, a long-term care insurance. In case someone becomes disabled, there's certain criteria, what they call disabled, like severely disabled. Then the person would receive a certain amount of money per month per care. It could either be for someone caring for them at home or in a facility. That's about the supplemental insurance. If anyone has questions, I posted my email address on the chat. You could email me, and whoever wants to get like a summary of what we've spoken about today, I'd be happy to write it up and summarize it for you and send it in to you. When you do arrive in Israel, You can sign up for your Copot at the airport right away. Now, you know, with going into quarantine, I'm not sure when you're going to be coming, what the situation is going to be like. But once you're able to meet with me, give me a call, we'll meet. I'll set you up with whatever you need. Before you come, if you have any questions about different medications, if they're covered, how much it would cost, where to go for whatever it is, I'm the person to turn to. I'd be happy to help you with anything you need within the Copot or within the community if you're coming to Ramat Beit Shemesh. Any questions about school, stores, electric appliances, whatever it is, feel free to ask me. Now, what I wanted to, I lost my, someone asked about Chinese medicine. So we do offer through the supplemental insurance different medicine. We have homeopathy, we have reflexology, we have osteopath, massage therapy, so many options. It's great. It's for very low cost. If we're talking about 70 shekels for a massage, what is 70 shekels? It's less than $20. Or acupuncture for 60 shekels, less than 70 shekels. There's great options here. People use it all the time. It's amazing. And you're not limited to the amount of sessions that you could use. Hopefully you don't need to use that many, but you're not limited. It's great for kids too, by the way. Let me see questions here on the chat. Okay.
Regarding medications that are available here, you can either go to health.gov.il or you can go to medic, medic.co.il. I think by medic, that's the basically the book that all the doctors have. It has all the medications that we have here in Israel. I think you have to sign up for that. So it's no big deal. It's just, you know, making a password and whatever. The one on the health.gov.il is the Mr. Bariut website, the health ministry website. And there they have all the English and the Hebrew. It's a nice site to go to anyway. You should see what kind of country this is. And when it comes to healthcare, it's amazing. And it's in all, you know, it's a whole website in English and Amharic and in Russian and in Arabic and in Hebrew. Russian too. I think there's also a Russian site, if I'm not mistaken.
Mentioning Russian, I understand there's a nice Russian community in the states that are thinking and planning to make Aliyah, which is amazing and exciting for us. We do have specifically in Leumit staff, that medical staff who are Russian speaking, family doctor in one of our actually more than one of our clinics, OBGYN, nurse, pharmacist, so many staff members that speak Russian. People are very happy in general with the service. And
they have an amazing there's an amazing barber in Ramat Beit Shemesh that speaks Russian. If you like my hair, so Leah's husband is an amazing barber, 10 years. Look at, I mean, he cuts a lot, right? But no, it looks great. Thanks, Leah.
Yeah. So I'm gonna put my phone number too on the chat. If you want to find out about specific medications, you don't have to go online, which is a good option. You could write to me. I'll find out with our pharmacist. If we don't have that specific medication, our pharmacist is going to offer something instead, and you'll see, consult with your doctors what to do about it before you come. When mentioned that you should bring 3 months supply, someone wrote that they can't get 3 months supply. It's okay. You usually can get your medication right away. We just tell you to bring 3 months supply in advance, just to make sure that you're calm about it and relaxed when you come here. If it's something urgent, we'll take care of you. You're here in good hands. Don't worry, okay? Now, medical records. So Dr. Rosenbaum mentioned that we could scan papers into our system. Now, there's another, so first of all, what medical records should you bring? You don't have to bring everything, I mean. You should bring in anything that you would like to follow up on in the future, or if you're in the middle of a process, you could bring all your medical records. That's fine. But make sure to bring what's important. If we're talking about kids who are in the middle of a process of child development services, bring in the evaluations. That's very important. If you've done, hearing and vision tests recently, and your kids need therapy, that will make things much easier, because you won't have to go and do that process when you come here.
I would bring everything. I would bring everything, but I would bring everything. Put it on a disc. Put it on a disc on key for you, and then you can print it out as need be when you get here. The Copot can only use the stuff that's a hard copy, but it's important that you do bring everything. You'll be surprised sometimes, like right now, COVID, like a lot of people need stuff. Not a lot. There's a number of patients we've had who've needed things, and they're trying to get their pediatrician who is not really so available right now. So bring all of your information in some form, and and then give us the most important things. There's a couple other things here I just wanted to cover that's on the side here. Can they read a CT from a CD? Usually. We do have pretty advanced reading things for MRI, CTs, things like that. I saw Israeli citizen living in U.S. I think Rivka can probably answer that. I think you need to be here 6 months before you get medical coverage again. Once you're a Toshav Choser, then you don't have any access to the Kupot for 6 months. Check me that on that, Rivka. Different referrals to the emergency room. Basically, your doctor can write it. Or if you go to Terem, the urgent care systems in Israel, then they can write you one. Or you can call the 24-hour call-in the center for your Kupa, and they can also refer you. Any other questions here we didn't do? How much and to what's LTC? You know what that is? Oh. Someone tell me what LTC is? We'll answer that. Medic site, medic.co.il. And the other one, health.gov.il. That's the Ministry of Health site. Long-term care. Okay, so I think Rivka mentioned that, but she can go through that some more. Will you be not helping? If you make Aliyah, you can't be refused anything. It doesn't matter what your background, medications, your previous conditions. Correct, Rivka? They can't refuse anyone who makes Aliyah.
And anyone can join the supplemental insurance too. No matter if you have medical history, everyone can join.
It's a great country. Where are you guys?
Rivka, do you want to go over on how, if people want to switch between Kupot, how does that work?
Yes. So, good question. You join a Kupa when you make Aliyah, but you could change your mind. If you're unhappy in whichever Kupa you've chosen, you could always switch Kupot, which is amazing. That it keeps the competition between the Kupot, because we want you to join us. So we try harder. We try to satisfy our customers, our members. So anyone could switch Kupa. It's easy. Once you're here in Israel and you want to switch, there's an option of doing it online or going to the post office with a Tudat Zehut, and you'll be switched to the Kupa of your choice. So don't be scared about choosing a Kupa, because if you chose a Kupa and you're unhappy, you could always choose a different Kupa. Hopefully, if you join Leumit, you'll be happy. You won't want to change a Kupa, which is usually what happens here. But you do have the option, so it's less pressure. Any other question? So every 2 months, there's an option of switching kupot, and then there's a waiting period of about a month and a half till it takes place. So you could finish up whatever appointments or you know, things you were in the middle of in your current kupa. Any other questions? Okay, the long-term care. So as I said beforehand, there's a long-term care insurance as opposed to the supplemental insurance that we spoke about and the kupa. The long-term care, not everyone can join at any point. Because we work with a insurance company that works in collaboration with the kupa, and that insurance company can decide that someone, they don't want someone to join the long-term care insurance. So you would go through a questionnaire, and once they approve you, then you're entitled to join it. Now, in general, we give care till 120 for whatever is necessary, doctors, medication, therapies, whatever it is. But Copad does not provide home care on the long term, meaning we would send in an occupational therapist to someone after surgery, or, you know, someone who is disabled, but it's not, you know, or a nurse if there's something that needs to be done at home. But this is not, you know, at home care. So there, for that long-term care, for that you would need the private insurance or the Coupa long-term care insurance. You could only join it till the age of 65, if I'm not mistaken. That's the limit. Any other questions? Let me see. Sorry, English is not my first language, so it doesn't come that naturally. Yeah.
You're doing great, Rivka. Absolutely wonderful. I wish our Hebrew would be that good.
So I see someone here asked about growth hormone. So growth hormone is covered by the Coupa for kids. If you've started already the process in the States, there's no reason why you shouldn't be able to continue it here. It does cost a certain amount of money, but it's not very expensive. You have to have the supplemental.
It depends whether it's growth hormone deficiency or if it's for idiopathic short stature. So, you know, send the details to Rivka and we will check that out as well.
And we have a great pediatric endocrinologist working in our clinic in Ramat Beit Shemesh, Dr. Flores Levy. She's the head of endocrinology, pediatric endocrinology in Sharitzedek.
Hi, can you hear me?
Yes.
Hi. My name's Yaakov Levy. Hi, my name's Yaakov Levy. I just sent the question before about the growth hormone. I didn't hear you said that such a thing would require supplemental insurance as well. Is that what you said?
To get it discounted, yes.
That depends. But no, I think if you're growth hormone deficient, then it's not. Only if if you're idiopathic short stature, then you can get it via the supplemental insurance.
Right. So our child is growth hormone deficient. Is not idiopathic because
I'm pretty
he
sure
went
that's
through.
Covered.
I'm certain of that because we went through the whole process in the United States of
It's a little different here than there. The numbers they use for the stimulation test are slightly different. So send the information to Rivka and we can check everything for you.
Okay, great. Okay, excellent. Great. Thank you.
Can I ask a quick question, please?
Yes.
I was wondering about the 6 months waiting period when we first become a limb. What do we do in between those first 6 months? How do we get covered?
We talking about first becoming Olim? Because first time, there's no 6 months wait. This is for people who are coming second time. People who are Israeli citizens who left and are coming back as a Toshav Choser. Then they have a 6 month waiting period till they're entitled for Coupa services.
And when do you consider when you are being considered as a returning Olim? Until what
If you've lived as an Israeli citizen in Israel after the age of 18, then and left, that will be and coming back, that will be considered a toshav chozer. If you were a minor and left, then you're katin chozer, and you're entitled immediately for all the benefits. If you're an Israeli citizen because your parents were Israeli but you never lived in Israel, then you're considered an Ezra Chole, and you're also entitled for all the benefits right away. You would have to go through Misrad HaKlita. It's a little bit more complicated, but within, it should be sorted out within 2 weeks or so.
Thank you.
You're welcome.
Thank you.
Hi. I keep writing my question, but it's not being answered.
Sorry.
I'm about to return to Israel. I left a year and a half ago. I was there for 5 years. It didn't work out. We're trying again. I want to know if I get pregnant, will I be able to get Coppa, or still for 6 months, nothing? I mean, that's important for me.
No, you would have to get a private insurance for those 6 months. The Coppa will not cover. We do offer a tourist insurance, which is very, very basic. With this tourist insurance, you'd be able to see an OBGYN, but it wouldn't cover much if chas v'chalila there's a need to go to the hospital, if any complications. I would recommend to get a good private insurance besides the tourist insurance that we offer in the Coppa.
And where would I go for the private insurance? Where
there's many insurance agencies. I could recommend some if you'd like. PM me and I'll send you details.
Thank you.
Welcome. Any further questions? Okay, so on the chat, I posted my email address and my phone number. I'm available on WhatsApp, on email. Send me any questions. We'll try to help you out through this process. It's always exciting, to deal with new olim. We're just thrilled and happy to help you through this. And I want to thank Leah and all people who are in charge of this support group, Aliyah. You're amazing. You inspire us. All of you who are planning Aliyah inspire us. This is the right thing to do. It's a good thing to do. It might be, emotionally hard, and in terms of the medical care, you could be calm, not too emotional. We'll take care of you. And all the rest of the aspects, it seems like it's working out here for people in our community. They're happy in general. I don't see people leaving. I see people coming. So it's great. And now more than ever, like this is the right thing to do. I'm sure you're eventually going to be thrilled here.
Thank you very much, Rivka, and thank you very much, Dr. Rosenzbaum. Thank you, Sophia and Rabbi Katzen, for putting this all together. We appreciate all your help and assistance for making this possible for the Olim to have a better Aliyah process. Thank you very much.
Thank you. See you.
Do you mind if I ask one more question, please?
Sure.
I wanted to find out about the hospitals that are near Bet Shemesh. You don't have hospitals within the Bet Shemesh, correct?
There is a plan of having a hospital in Beit Shemesh. I see Dr. Rosenzbaum had left us. He's involved in this. He's involved for many years in the planning of hospital in Ramat Beit Shemesh, which is going to happen eventually, hopefully before we're geriatric. There we have Beit Shemesh is located close to, it's centrally located, meaning we work with Hadassah and Shari Tzedek, and in the Merkaz closer to Tel Aviv with many different hospitals. In an ambulance, you could get from Beit Shemesh to a hospital within less than 20 minutes when they drive fast. So now roads are faster. It's close. It's easy. From Beit Shemesh to Jerusalem in general, it's about a half an hour drive. It's not far. And when with a ambulance, it's just so much closer. It will be amazing when we have a hospital here, but we manage with the hospitals around us. And they're good hospitals.
Thank you.
You're welcome.
Can you possibly send your email, because I'm not sure where to find it?
Sure, I'll write it down again now and on the chat. It's rivka.leumit@gmail.com. Okay.
Thank you so much.
You're welcome.
I have a quick question. So you mentioned that as an Israeli citizen living outside of the country, you have to come, when you come back, you have to wait for 6 months in order to get the coverage. So if you are getting that private insurance, what is the approximate price of that?
Oh, it really depends on your medical situation, your age, and the coverage you get. Because there's, there's like the best coverage and there's basic coverage. It could come out to be, I don't know, 60 shekels a month, or it could come out to be 600 shekels a month, and it might not cover some pre-existing medical conditions. So you really have to speak to a private insurance agent. I can't tell you much about it because I haven't been dealing with private insurances.
Okay, thank you.
You're welcome. But it's definitely very important to make sure you're set before you come. Okay?
I got a question in the chat. How somebody wants to find out how they can transfer their credentials to Israel in the medical profession.
How they could their qualifications.
Like this person is a geneticist. What is the best way to transfer their credentials in the medical field?
Okay, so we have the doctors who are in charge of hiring doctors or people in the medical field. You could send me your information, and I'll have the doctor in charge contact you and give you the information about how to work at your license and get a job here.
Thank you. I'll pass it on.
Okay, my pleasure. Okay, thank you, everybody.
May I ask you a question?
Yes.
So that my situation and the question is probably a little bit more specific, but I'm sure it will be very important for a lot of people. I'm talking about we coming and we decided to come with our old parents. Like, for example, my mother is 97 and my spouse's mother is 95. I know that we will have a lot of fun with all of these. So it's a kind of mix of medical and social services. What is the best way? I understand I'm not asking for anything in particular, but what is the best way how to address it?
I think the best way is to consult with a primary care doctor, speak to them about all the medical needs of your parents, or if it's for yourself, whatever it is, because it's usually more complicated. And the doctor will assist you with it. So in general, I don't know if you heard through the video that we had in the beginning, Dr. Barron, for instance, he specialized in geriatrics. So he would be the person to turn to for this. Each case is different. So you really have to find out about, what's available, where, if it's convenient, and, work it out before you come in. You could turn to me, obviously, about it too. And I'll refer you to the right people in the Coppa.
Thank you so much.
My pleasure.
If I can just add here that the Coppa has a lot of Russian doctors, and I'm sure that your parents will be more comfortable speaking Russian to the doctors, so that you can be rest assured that your parents will be comfortable and given the right care, whether it's in Russian, in English, in Hebrew, and I know there's other languages available at the Coppa. So I personally can only say good things. The personal care on the level that the Coppa gives the care is phenomenal. So I want to wish everyone a good luck and successful Aliyah, and we're here to assist you in every way we can.
Thank you.
Thank you so much for a wonderful presentation, and we'll pass on all the information. I'm sure that people will have many more questions, and maybe we can do a follow-up event at some point. Yes, thank you so much for your time.
I would like to also thank you very much for giving us the opportunity to use your Zoom connection, and without you wouldn't be possible.
We want to thank you to be a pioneer moving forward so many Jews back to their homeland. We're actually coming back home. We want to thank you. And you help us to take care of not only of the soul and the body as well. And it all comes together.
I apologize. Was this recorded? Because I couldn't get on in time.
Yes. Yes. First of all, you'll find it on our Facebook pages, and also I'll share the YouTube video with our WhatsApp groups.
Okay. Thank you so much. Thank you.
All the best.
All right. Thank you. Thank you, everybody.
Thank you.